Hello and welcome to your programme Q&A webinar session. Today's session will cover the MSc Advanced Nursing Practice and MSc Advanced Practice in Healthcare. And we're joined by our panel today who are hopefully going to answer any questions you have about the programmes. So I think first off, we are recording the session, so don't panic if you miss anything. You will get sent the link to watch it back afterwards. And it's not your only time to ask questions. If after the session you think of anything else, the administration email address is on each of the programme web pages, so do get in contact with us through that link. So I think we'll kick off. Hazel, would you like to start and introduce yourself?
Yeah. Hello, I'm Hazel Hill. I am current acting programme lead for the Masters in Advanced Nursing Practice and Advanced Healthcare. I am a nurse lecturer first and foremost, and I have years' experience as being a nurse lecturer and came into my advanced practice as a nurse through Glasgow University when I specialised in palliative care so many years ago that I wouldn't like to tell you, and I'm looking forward to working with you at Glasgow University.
Kim?
Hi everyone, I'm Kim Holmes. I'm the administrator for the postgraduate top programme, both Advanced Nursing Science and Advanced Practice Healthcare. So I support the academics with delivering the programme and support the students with anything from registration to enrolling for their courses, accessing Moodle, submitting their assignments, and just any other support that they need throughout their time on the programme.
Perfect. And speaking of students, Iman, would you like to introduce yourself?
Yeah, hi. My name is Iman Ma'mari, and I'm international student for the Advanced Nursing Program. And I came from Sultanate of Oman for the postgraduate, program.
Well, thanks for joining us. Hazel, would you like to kick off? I know you've got a presentation there if you want to share your screen.
Right, let's see if we can get this presentation up. Okay, sharing. Super. Excellent. So hopefully you can all see that. Is that showing up yet as a full screen?
Yes, that's us.
Just give it a wee second. Super. So that's just a nice wee introduction slide with our pretty campus here at Glasgow University. So you're interested in coming to Glasgow University. It's a brilliant university. It's been around for a long, long time. So established in 1451. It is one of the world's top universities. We are very forward thinking. So although we've been around a long time, we don't just sit there and get on with things. We're constantly striving to do new things, to develop in the worldwide areas of sustainability and taking research and healthcare forward. We've got a fantastic School of Medicine, Veterinary and Life Science, a College of Medicine, Veterinary and Life Science, and you'll be working within not just the nursing school, but the School of Medicine, Dentistry and Nursing, working with a lot of different practitioners involved in your postgraduate journey, which will take you on, hopefully some of you on, to become some of these world-class researchers that we have here at Glasgow. Iman, is there anything you'd like to say about coming to Glasgow and Glasgow University, as you've come from a long way away?
Yeah. Actually, I get acceptance from different university in the United Kingdom, but really I heard a lot about University of Glasgow from my colleagues who already graduated from the University of Glasgow about how the atmosphere there in the university, how the people are welcoming and how it's easy to approach, how they are supportive. So really, I like joining University of Glasgow, and I give the priority, to get in this honored university. So really, I'm lucky being a student at the University of Glasgow.
Yes, and it's a very vibrant university environment. I worked in a number of universities. I've studied at a few universities as well. And I am being honest, every time I go into the library or the public spaces here, the enthusiasm for the students and the busyness is something that really grabs us. So it is an excellent university.
Yeah, really.
And students seem to really enjoy the experience. We have 43,000-ish students. So that number's always changing, from over 140 countries. And you get that feeling when you're walking about the university of that really multicultural vibe, which is really good. We are ranked in the UK's top 20 for graduate employability, and in healthcare, that's an especially high thing. We're very good at getting our students are very recognised when people have come here. But also, coming to university isn't just about studying, and that's true when you're doing a master's programme as well. So we have lots of different clubs and societies, and we have opportunities to work abroad. That doesn't quite work. On this programme, we're doing it the other way. We're getting lots of people from different countries coming to us. Iman, have you been involved? Have you joined any of the clubs and societies or heard of any of the other students doing that?
Actually, no, I didn't join, but I heard some of the students, they are joining and they are enjoying about the different activities. I joined once of the, occasions that was done by the student support team in the university, and it was really, interesting. It was once, but I enjoyed. There is a lot of opportunities to hear about the different, clubs, about the different opportunities. So always we get informed, but it was nice experience.
Yeah. And we hear that regularly. We have student staff groups meetings where we get together to just see how the programme's going, and we have representatives from the students there.
Yeah.
And I think, Kim, you were at one of the meetings again where one of the students was talking, they were talking about Kayleys and various different things that they came to experience the culture over here in Scotland, which was quite good.
Yeah, and it's really good for the students as well. You know, it's an unfamiliar country for some as well, and it's good to just soak up that new culture. And the university is very welcoming with all the different clubs and societies on offer. So it is a good thing to be a student in the university, and with so many other, you know, clubs to join and things as well as study. So it's not just all work.
Yeah.
And our UK students feel that as well. Unfortunately, our UK student that was going to join us today has had to work this morning, so she couldn't join us. But again, for UK students, it's quite often coming back to clubs and things that they've done before and taking that forward. So there is that nice environment and get that balance right. So why study to advance your nursing or healthcare practice here at the University of Glasgow? Lots of other universities offer this, but we are going to therefore get the opportunity to study within one of the top nursing and midwifery schools in the UK. Currently, some of the league tables have us at the top of that league, and we work very well. We work in small groups and classes where the students are very collaborative within the working. It's not a case of us as lecturers or academics or the clinicians that come in to support you standing and talking at you. We very much like to give students work and reading in advance so that they're coming to class with some preparation and some thoughts, because you have your foundation already coming on to these courses. You have your foundations in nursing or healthcare practice. And what you're wanting to do when you're coming on here is to build on that and advance it. So we want you to take that clinical experience that you've already got and do some thinking about the theory in academia, and then come together as a group to work and develop your skills and knowledge. So we would say our smaller class sizes are one of the positives of our teaching style, and also the fact that some of your courses are just for our programme, but other courses we link in with wider programmes across the medicine and dentistry nursing school. How have you found the fact that we like to kind of get you involved in these discussions, Iman?
You mean regarding the classes?
Yes.
Yeah, I enjoyed really being, in the small groups that we are discussing, because we get exposed not only to the, UK system, but also to the different systems from the other international student. So we are comparing how the health system is going on, how we can improve, how can we introduce a new thing to our country. So we get the benefit. We see how, the updates there in the with the British people who is studying with us, how the system is advanced. So really we are learning from them, and we look to the to application of these things to in our country, because this is how the main focus of our country is to expose us to different health system. How can we improve it in two sides, in the service system and also in the educational system? So really, I'm lucky for being in that small discussions where we get exposed, and also it keeps us also interactive in the whole class. So we don't lose attentions, we share our thoughts. So we enjoyed, it's really one of the positive things that we are implementing in the classes.
Yeah, and it helps you to as well, hopefully, move forward with your assignment work, that it's not just these assignments at the end, but we'll talk a wee bit more about assignments as we go through the presentation. Cool. So this is kind of an overview of how the programs work. So within the programs, you are aiming to get 180 credits at the end of the time to gain your master's. There are 5 on this program. There are 5 core courses that you each must take. And I'll talk in the next slide. I'll show you a bit more about how that works over the years. So each of the courses has got its 20 credits, and then we have one optional course as well. So you do that to get your 120 credits, and then hopefully from there, if you receive a high enough overall grade average, you will then move on where you will do your independent project, where you'll get your further 60 credits, and that will take you on to your master's. The core courses and the optional course are on-campus teaching. And I've put the teaching in little brackets because, as we were just saying before, it's not about us lecturing to you, it's about this collaborative working together. But that's when you will come into university for class time. Now, the class time varies depending on where we are within the semesters. So fitting in these 6 different taught courses involves a lot of planning. So some of the taught courses, there will be a wee bit of overlap. Some of the taught courses, you will have the full courses running next to each other. So some weeks it might only be as little as 4 hours taught teaching, some weeks 8. But as well as that, working at master's level is a very independent process. We will guide you with that. We will give you exercises to do with that. But you are also going on to develop your knowledge and skills in areas of advanced practice that are appropriate for your background and for where you want to go in your future. So a lot of the time is spent doing independent study. Now, that doesn't necessarily mean you're sitting on your own in an isolated area. If you are just doing it on your own, quite often the students like to use our brilliant library facility, and then they give each other lots of good support. But also we offer lots of additional educational sessions that master students can dip into. So we have a brilliant student learning service that run courses about academic writing, for example, and you can go on to them on your own. You can arrange to have them as a group. You can have face-to-face support with that. You'll have to do literature searching. So again, we have a brilliant library team supporting us who can do courses for that, who have online courses that you can do, who can do face-to-face sessions. So you might be spending your time working on that. Really, if you're doing the full-time course, it is a commitment to working the same number of hours as a normal working week. So in the UK, don't know whether this is a good thing or a bad thing, but that's about 35 hours a week. So there is a lot of work involved. And so you have that responsibility to keep up with that. But you have your program teams, myself, Claire, Kim, and the other module leaders supporting you in the background there. And also, I think as students, you support each other a lot with your independent study. I feel that that's something that's come across a lot from the classes. I don't know if that's been your thoughts, Iman.
Yeah, regarding first I start talking about the courses. Since I was in my country, I was able to look for the different courses that are presented in my program. So I had everything planned from the beginning about the core courses, the optional courses. So I like this, how it's well planned. So I have a clear focus for the whole year. I can plan it for the whole year. So the people who is planning to work as part-time, the time management is highly appreciated in the postgraduate program, because really we are not much pressurized with the classes, in-campus classes. Mostly it's our own independent study or working, where we can manage our timing if they are thinking to study and to work at the same time. For me, I'm not working. just doing my, study, but there is plenty of time. And as a mom, I care for, for my children also, so that it gives, I do a good time planning where I can focus on my family side, on my study side. So the program is really well planned to support the adult learner in how to plan their, the whole year of the program. So really, I was happy. And also there is the timing is fixed from the beginning, the courses we are exposed to. So I did my planning from the beginning before even I join. And also about the handbook, the student handbook that was presented, it was really clear how many assignment we need to submit, what is needed from us. So already our plan is, the strategy is already present in our mind of how the course is going on. So I really appreciated that well planned program. Then going to the campus, you will find a lot of support there. The student support team, the academic teacher, they are well supported. The administrative people also, Miss Dr. Kim, she is really, we appreciate her help always when we are asking or we need a support. It's within, short time, we get whatever we are looking for. So I'm really happy with this course, of advanced nursing.
And I think that's a nice comment to make about Kim. We could not survive without Kim. Kim keeps us all right all the time. I don't know if you want to come on, Kim. I think some students, one of the things they're interested in is, do they have to commit now to what their optional module is?
No, but as Aman had said, everything is detailed in advance. Everything's available on the website, including all the courses. So you can go onto the website and have a look at, the course ILOs just to see what's involved in the teaching, what the learning outcomes are, and if it's something, in your specialism or something you're interested in, it's useful to have a read up on it, just to know your options. But at the start of the semester, we do have a programme induction. So we all meet in person, which is good because you get to meet your fellow classmates. And we go over the programmes that will be delivered. So there is a bit of an insight as to what you can choose. And I think you may have about a month or so to make that decision, because you will need to enrol and spaces fill up very quickly. So we need to make sure there are spaces on the course for you. So we would advise doing your research beforehand so you have an idea of the course you want to enrol for. And we give till about maybe October, November, before the end of the first semester, as the teaching is in semester 2. So we want to get you enrolled as soon as possible.
And that brings quite nicely on to the next slide that shows that why you can have that little bit of time to make your decision about your optional module. So this is a layout of the programme as a whole. So in semester 1, which runs September to December, so you do get holidays, don't worry about that. You definitely have some downtime. We have 3 core modules, and what we're doing with those modules is we're really building in the programme. So we start off, the order on here isn't necessarily the order they run on, but we start off looking at research because it's really important that we know about evidence-based. So you have your research module, you then have your how we're going to apply that research to practice course. Sorry, where I came from before, we called them modules, or courses we call them here. And then you're applying your research. So you do those 3, and they don't always overlap. So all 3 are not running at the same time. They're shorter courses. So you have time to focus on one, and then start developing the work on that before you start the next. So we work on them throughout each semester. Then in semester 2, that's when you need to know when your optional modules are. So we have the education module and we have the leadership module, and they usually sit across 2 different halves of semester 2. And at the same time, you will then be doing one of your optional modules. So your 3 optional modules are your acute and critical care module, your global health challenges module, and the self-management module. And we hope to offer all 3 of those next year. What you do is you make your decision, you put yourselves forward for which courses you want, And then as long as we get the adequate numbers, that will run for the next year. So sometimes we have to be a bit flexible with that. But the good thing about it is that you are choosing within each of your courses what you focus your assessment work on. So you can go on to actually get your master's will be specialised field awards, potentially in acute and critical care or in global health challenges, or you can just have your general master's. So that all depends on whether you focus your studies or not. And then we have in your third semester, at the end of the year, we have your independent project. Now, officially, your official work on that is the main bulk of your work on that runs in semester 3, but actually we try to encourage you to think about your topic for your independent project right early on when you're starting the course. And for that, you'll get a supervisor and you'll start working on that to the level that feels happy for you earlier on in the course. I think we'll come back to talk a wee bit more about the independent project just shortly. I'm trying to think if there's anything else to say in that. Okay. So how do we do our learning? We've talked a little bit about that. We do a lot of group work in the classes. You'll be given theory. We have our online interactive system where we'll have things which we call Moodle, where we put the course handbook, all the course information. We present the lectures that we will be using for teaching. We get them up in advance so that you know what we're doing, and we'll sometimes give you work to do for that. Then you will come into the classes. You might be getting some theory given by the course leads, but also we'll bring in clinicians from elsewhere. We bring in our colleagues from across the whole of the university and people from policy. And some of the work will be in lecture form, some of it will be in tutorials form. And you will be asked to do presentations as well. So there will be informal presentations when you're asked to say things in class. There will be formative assessment presentations, and some of your actual assessments will be presentations. You are also working very closely together to help support each other, and as part of that, you're assessing each other, so using peer review. And one of the key things that we do within nursing and healthcare practice is reflective practice, and we build on that very much throughout the course. So we're asking you to think about what you do in your practice and how you're going to take that forward. And we do some essay work, and that can be quite different for students. So most of our assessments are of a similar form to having essays and things. So it's a very open and different teaching and learning process. And what we're trying to do, as I say, is start off the course looking at what evidence-based practice is. And some of you will come to the course already having a good knowledge of evidence-based practice, and some of you that will be relatively new. So that's very dependent on where you're coming from for your educational background. So we start off with the theory of research, and at the end of that course is assessed from you actually doing some critical review of some research papers, and your feedback that you get from that you then build into your next assessments. We then start to look at theory and policy and the use of guidelines, and you'll review a clinical guideline from anywhere in the world and see how you use that to apply to your practice. But then, because you're learning to become advanced practitioners, there are other skills that you need to develop. So you will develop the skills of actually being the researcher yourself. So our third course, we're actually looking at how are you going to research an aspect. So you get to choose a topic of your interest and consider how you're going to research that. You then do a presentation to the class on what you're going to do for that research. And that would be similar to the kind of presentations you would do if you're looking for funders for research. And your assessment for that course is actually to do an ethics application where you have to justify your research, why you're doing it, and how you're doing it. And then other aspects of being an advanced practitioner is that we then become leaders. So we have a module where we're looking at leadership, and we are also always educating people, whether that be our colleagues, our peers, our patients, or coming into formal education roles. And we have a range of different practitioners for that. And then when you go in, so for those assessments, you're looking at how you would use your own leadership skills, how you would use your educational skills, and how you're going to show that you've advanced them. And then in your optional modules, you focus on pulling all of this together to say what you would do about your type of care that you offer in practice, and hopefully then going on to your independent project. I don't know how, if you want to make a comment at all, Iman, about the differences in the learning styles and how you found adapting to that.
Yeah, of course. So it depended, I mean, on where we came and how we started. For example, for me, as a personal experience, I started my first qualification in my country. Then I took the second qualification in the United States of America. This is my third qualification here in the UK. So really, it was different experience from the previous two experience. It was challenging, even though everything is present there. But I mean, all the resources is there, but we need to work hard because it was different experience. We didn't get used for the, I mean, academic writing, I mean, critical thinking, the application of theoretical knowledge in practice. So it was challenging at the beginning, but with the hard work, with the use of different resources present for us, either from the library, or all the resources that is present in the model platform, which is really helpful. All the, I mean, focused classes from the teacher that, I mean, exposing us about the different resources present, about the different concepts, how we can apply whatever we learned, we got the help. At the beginning, it was really difficult, but I'm advising everyone to, I mean, to improve is to work hard I mean, to read and to look for different resources which is present, to utilize what is present there in model by the academic teacher present, I mean, provided for us, because really it is targeted and well planned. It was very hard for me at the beginning, but later I was happy with all of the support that I had. I improved. I know it was not easy, but at the end I reached my target. And it was, I mean, a nice and different experience.
Excellent. And Kim as well is very good at publishing and sharing all these different support services that are available. We get reminders every so often when new things are coming up. That's good. Okay, so the independent project. So this is what really stands you out. This is you creating your dissertation for your master's. This is you working not totally on your own, but you choose your topic and decide where your focus wants to be for your future practice, for your future career, and where you're going to take things. You let us know about the topic that you're interested in. So it can be about absolutely anything. It can be about advancing your educational skills. It can be about a specific clinical condition. You need to make sure that it's focused on your nursing or healthcare background and usable for that. You will let us know what your topic is going to be, and as soon as we can in the programme, so although you officially start your work in your independent project in semester 3, we want to get you knowing your supervisor and thinking about your topic earlier on so that you can be using your studies for that. So you're allocated a supervisor who will support you throughout your studies. You'll meet with them regularly and they will talk you through the different phases that you need to do to gain your dissertation. Towards the end of your time in your dissertation, part of your assessment will be to give a poster presentation on your project, and then you will present your 7,000 word dissertation for marking. And Iman's just she's been engaging well and is just beginning on this process. So we shall see how she feels about that later on as the year progresses, which will be good. So why do this Masters? So this Masters will offer you great prospects for your career. It will show that you're working at that higher level so that you can be a leader and a manager and a practice and policy influencer across health and social care and nursing. And I suppose just what I think a final point, because I'm aware of time here, one of the biggest questions that students ask is how do we prepare for our Masters? So there's some tips on there from me, but I think Iman would be a better person to kind of share with you about that.
So regarding the selection of topics, first I'll start. So I like the flexibility that we can select a topic which is matching our own focus. For example, because I'm in the nursing education, so always I select the topics which fits my working experience, and I work for a new I like to select topics where can I advance myself, and when I'm going back to my country, I can advance the institution that I'm working with. So I like the flexibility of allowing the student to select their own topic for their own for the projects, which it meets also the IEL laws of the course. Regarding the dissertation, the good thing that we started from the first semester, we took some of the lectures to expose us how we can start to select our topic, what are the available resources to look for, and even the handbook from the student handbook, it was present there from the beginning. So it's a good guidance for us how we can expect for us what to do there in the independent project. Also, Dr. Kam, she introduced, she assigned for us our own supervisor who is, good and well qualified on the topic that we selected. We met with our supervisor, we discussed about our topic, our research question, and how can we take the maximum benefit from searching it. And really, I find a good, guidance with my supervisor. So I'm working with it, but the good thing that we don't start only from the last semester working from the end for the independent project. From the beginning, we are exposed to. So we know we are not, the anxiety or the stress that thinking for the independent projects, it reduced with the early exposure for the requirement of that program. So it was good, for me.
And I think the thing for coming to the course is but start thinking about what it is that you're interested in and kind of how you can balance things. There's a brilliant website. The information for new students has got lots of information on it there. So please do have a look at things like that and think about giving yourself time to come to Glasgow to familiarise yourself. I mean, just a day or so, don't rock up and start at 9 o'clock that first morning having no idea of where to come to the university. There's websites, there's an app that can kind of help you with that. So plan that and have a think about how am I going to balance my studies, my working life, and my fun in life while I'm doing these studies, because you should be able to have that. And if there's anything anybody wants to ask, you can also get in touch with us. And we'll kind of help you out. And if you ask before the current students finish, I'll put out a wee question to all of them for any feedback if it's about student experience. So I hope this has been of value to you. Is there anything else, Kim, you want to add at all? Or
no, everything's been covered. And as we said, the students that do join the programme, we have our induction session where this is all gone over again. So just to prepare you for the year ahead. But no, everything's been covered and everything is available on the website, and just email us if there are any questions.
brilliant, thank you.
Thanks, Hazel. And like we said, the session has been recorded, so that will be sent out maybe later today or tomorrow for you to watch back. And do get in touch if there's any questions. And in the coming months, you'll start receiving some emails about registration, things like that. So do keep an eye on all those emails that will come in, because there's lots of useful information that will come your way. But thanks to our panel for taking time out of your day. I know you've got a lot on, and it was lovely to hear from you all. So yeah, thanks, and hopefully we'll see you all come September. Thank you. Bye bye.
Thanks very much.
Thank
Bye.
you.
Bye.
Salat, have a good day.